This weekend, there's a virtual summit that will focus on maternal health. It's an effort by the organization Black Door Society to raise awareness and improve the outcomes for pregnant women. Joining me now to discuss are two of the doctors leading the event, Dr. Adebola Ajao and Dr. Shafanya Turner. Thank you, ladies, for joining me. Let's jump right in. Dr. Ajao, break down for us the current state of maternal health outcomes locally and explain to our viewers what the data shows when it comes to racial disparities.
Yeah, thank you so much for having us. We really appreciate the opportunity. So when we look at the local data, we see that the disparity between white women and Black women persists even at the local level. At the national level, the U.S. really lags behind many high-income countries. But when you look at the local level, you still see that data disparity persist. Essentially, Black women are 3 times more likely to die from pregnancy-related causes. And if we look at the local level, like at the D.C. area, D.C. actually has one of the highest maternal mortality in the U.S. And D.C. Black women are 4 times more likely to die compared to their white counterparts. This is a really huge problem. It's really important that we as Black women really understand this data and the risk factors and the warning signs in pregnancy.
It feels like we've been having this conversation for quite some time, Dr. Ajao. I'm just wondering, have the numbers improved over, let's say, the last 5 years?
Unfortunately not. Actually, if you look at the data from the CDC, the maternal mortality in the U.S. has actually been increasing over time. And so whatever efforts we're making is not working. And it's time to have real conversations about our health status and the risk factors that's making this disparity persist between Black women and other racial groups.
Yeah, I know it's really concerning. As a recent mom, my son is now 2 years old, but these were all things that I was considering. And Dr. Turner, for someone who is pregnant or planning a pregnancy, this can be frightening. What are the most important questions they should be asking their provider?
Hi, Michelle. Thank you for having us. Yeah, I think overall, I think patients need to understand that you can ask questions. Ask questions about everything, every test, every lab, every result. I think patients tend to be very passive when it comes to their health because it's scary and it's complex and the words they don't know. And you're in vulnerable situations. You know what you want the outcome to be, but you don't know how you're going to get there. So more than anything, patients, you can ask to understand your healthcare plan and what options are out there for all the tests and outcomes that can come about.
Sometimes I would go to my appointments with a notebook because I didn't want to forget anything. And I think that also shows the provider that you're prepared and you're going to be your own best advocate. Dr. Ajao, are there certain risk factors that families should better understand as they think about pregnancy?
Absolutely. I think one of the challenges we have as Black women is that we carry a high burden of chronic diseases. So think of hypertension, obesity, diabetes. If you look at the data, Black women have a high proportion of Black women are hypertensive in the U.S., approximately around 60%, and about 56% of Black women are obese. And all of this are risk factors for worse pregnancy outcomes. So we really need to take control of our health. We need to know our numbers, our blood pressure. We need to have them under control because essentially a healthy woman is a healthy pregnant woman and is a healthy baby and healthy pregnancy outcomes. So we really need to take control of our health in order to have more positive pregnancy outcomes.
And Dr. Turner, this weekend's webinar will tackle, of course, these topics and much more when it comes to women's health. What kind of resources do you want people to know about?
Well, this week is Black Maternal Health Week. Actually, it starts on April the 11th. So there's going to be stuff all over the internet and social media and things. But always go to the actual societies and associations of these professional organizations. So the American Academy of Family Physicians, the American College of Obstetrics and Gynecology, the American Society of Anesthesiology. Go to their pages and look specifically for information on pregnancy and pregnant women. And also, when you go into the doctor, like you did, and like you said, you come with the notebook, You come with questions already, and it's even okay to bring somebody with you to help you, guide you and take information in for you again, because those moments are scary and very vulnerable. So bring everything you need to take notes and be prepared.
Yeah, this is such an important topic and resource, and I encourage even those who are maybe just a friend of someone who is preparing for a new loved one to enter the world of pregnancy. This is good for the whole community to be aware of all of these important resources. And to register for this maternal health webinar, just go to blackdoorsociety.org. And it's right there at the top, from risk to resources. Thank you both for joining us this afternoon.
Thank you for having me.
Thank you for having us.
Okay.